Hi, my name is Lauren Suarez, and I have had certain experiences happen in my life that guided me to choose nursing as a career. Christina Halemeyer states that every nurse was drawn to nursing because of a desire to care, serve, or to help. I believe that every person who becomes a nurse is a special type of person that truly cares about people and enjoys helping others. There are many responsibilities when being called to a particular profession. For me, the responsibilities of being called to a nursing profession are based on what area of nursing I choose. I would love to work on a rehabilitation unit in a hospital and help patients reach their optimal health after coming out of surgery or any other type of procedure. The responsibilities that I would have while working in this area of nursing would be establishing goals with the rehab team that results in the best possible outcome for the patient, communicating effectively with my team members and my patients, and maintaining a strong commitment to my team members and patients. I believe that maintaining a strong commitment to my patients is a great way to build trust. What the personal meaning of nursing as a calling means to me is treating my patients as if they were my own family members, and not treating them as if they are just another person. Although I want to work on a rehabilitation unit once I graduate, I also have a heart for older people. The past 4 years have been extremely difficult for my family and I. We've had to say goodbye to 7 different family members, aunts, uncles, and grandparents, one of those 7 being my mama. She was diagnosed with lung cancer in the spring of 2013. Which then spread to her brain and ended up taking her life. I watched my mama's nurses care for her and love her as she battled this horrible disease. The nurses were so compassionate towards my mama, and after watching these loving nurses care for my mama, I knew I needed to be a nurse and help others just like how the nurses cared for my loved one. My feelings about being called into nursing are also based on my past surgeries I have had. The nurses and doctors that were there for me when I went through my surgeries were the most selfless people. They took extra time to help me reach my best self after my surgeries and treated me with respect. After witnessing the kindness and empathy these nurses and doctors had for me, this gave me the desire to want to show that to my future patients and impact their lives in a positive way as well. Although the surgeries I went through were not fun, the nurses I had taking care of me were always there to put a smile on my face, assisted me when I needed help, and made me feel accepted. Accepting individuals for who they are as a person and learning not to judge them is something that we as nurses need to learn to do before entering the workforce. When we are able to accept people for who they are, we learn a lot about others and ourselves. As I have progressed through B253, I have learned how to communicate more effectively by completing the projects that have been assigned. I will be able to carry these communicating skills out into the workplace by being able to communicate efficiently with my patients and coworkers. I believe that a calling is continued over time through the experiences that one goes through. If I would have never experienced the surgeries I went through, I would have not made the decision to become a nurse. A calling is dependent on life situations that people are put through, and I believe that the people who are called to be a nurse are compassionate, loving, caring people.